Good afternoon, everybody, and welcome to our live event this afternoon on the West Cumberland Hospital Phase 2 redevelopment. So I'm Kath Hughes, I'm the Head of Communication Services for the Trust, and joining me to tell you all about it this afternoon is Dean Oliver, who's the Director of Performance, Mr Mike Walker, Consultant Surgeon at West Cumberland Hospital, and Yvonne Fairburn, the Associate Director of Operations. So I'm going to hand straight over to Dean, who's going to run through a short presentation, and then there'll be an opportunity to ask questions at the end. So Dean, over to you.
Thank you, Kath, and hello and welcome everybody who's joining us here today. First of all, I'm delighted to actually be here today, actually talking about the West Cumberland Hospital Phase 2 development. I think it's an incredibly exciting opportunity and something which I'm very, very proud to be associated with. Today's event is really to seek feedback from not just our members of staff, but our community as well, in terms of helping to shape this next stage and phase of the development. Could we go to the next slide, please? So just in terms of an agenda, we've put a little bit of an agenda together just to help shape some of the information we'd like to share with you today. First of all, we'll talk a little bit about the event itself and what we're hoping to achieve. I would like to share with you a bit of an overview in terms of where we're at currently on the West Cumberland Hospital redevelopment and some of the timescales associated with that. I'll then like to hand over to my colleague, Mike Walker, who's going to talk a little bit more about the clinical principles and model and what we're aiming to achieve and deliver from the development. And then hopefully there will be plenty of time to respond to some questions and most importantly for me to listen to any feedback from our members of the community on the development. So if we'll go to the next slide, please. So just looking at this about today really relates to the Phase 2 redevelopment of the West Cumberland Hospital site. It's really about the proposed building and the improvement in the environment that we're looking to make as a result of hopefully securing this next stage of approval associated with our proposals. It's not really about service change in its broader sense. The key requirement that we have to make at the moment is we need to move the development on. We've recently received our outline business case approval. The next couple of months we are required to develop what's called a full business case development, which really takes the parameters of the initial business case down in a lot more detail, smaller detail, and that's really what we're aiming to try to get some feedback on over the next couple of months. Some questions have already been submitted in advance, so we will hopefully respond to these shortly. But please remember, if any questions occur to you, you can use the chat box at the bottom right hand side of the screen, register any questions, and hopefully if there's time, Kath will pick them up towards the end of the event. If not, we will respond to each and every question that is raised and we will publish those, make those answers readily available. Go to the next slide, please. So as I said, the exciting thing for me at the moment is we have actually got the green light for Phase 2. Our outline business case was approved by NHS Improvement last year, and now we're on the cusp of hopefully securing a £40 million investment and a massive upgrade in the facilities at the West Cumberland site, which will benefit both patients and our staff who work there. It will replace approximately 40% of the original structure at West Cumberland and build upon the £90 million Phase 1 development of the project, which was completed way back in 2015. For colleagues, for members of the community who are familiar with the site, I'm sure you'll see an awful lot of demolition works going on at the moment, and we have undertaken those works within our overall planning timetable to make way for the proposed 60-bedded inpatient unit, which will encompass elderly care, step-down facilities and specialist palliative care. The plans also include the provision of a short-stay paediatric assessment unit and an assessment area and a 7-patient bedded area. The whole project is hoped to create a much our patient quality environment, and as I say, really signal a really exciting investment time for our West Cumberland site. Go to the next slide, please. An awful lot of work has gone on thus far. As I say, I've been appointed as the Senior Responsible Officer on behalf of the Trust Board, who's overseeing the development of the full business case, to help the Trust and its partners develop The detailed plans which I referred to, we have been granted access to £3.2 million worth of non-recurrent investment that we are currently in the process of using and working with professional support and design and construction colleagues to be able to help understand what the implications of this detailed design and enabling works could look like. At the same time, I'm delighted to be able to say that we also received some additional funding via another fund, which has helped us construct the same-day emergency care facility, commonly known as ESTEC, actually on the site, which we've got targeted. The bulk of the work will be complete by March 2021 this year, although we might have some slight enabling measures that we still need to do, which might take us into the first or second week in April. The project to help oversee some really significant milestones over the coming months, we have re-established our project board and the stakeholder group, and to support the work of those groups, we have revised and updated our governance arrangements. Graham's Construction has also been appointed under the Standard DH Department of Health Procurement Framework Agreement, Pro Q22, and they're actively working in partnership with the Trust to help look at the design and construction implications that we can reflect in the business case. Could we go to the next slide, please? In terms of looking forward, as I say, the expected first milestone will be the completion of the same-day emergency care facility on the West Cumberland Hospital site. We do need to do some further work as part of the full business case proposal to look at some of the broader benefits that we're expecting from the development. So in other words, things to do with preventing avoidable hospital admissions or looking to repatriate and make it more accessible for a local community to actually attend West Cumberland Hospital for some care, episodes of care that they may have at other times maybe travelled beyond the current borders to receive that care. So part of the intention will be to try and help repatriate and bring some of that activity back to be provided locally. The key milestone for April will be to finalise the design for the facility, and it's intended by the end of June to have a full business case completed, which the Trust Board can consider and hopefully sign off. Part of the business case will need to show the elements of staff and community feedback, which we'll need to show and reflect in terms of how things have been responded to in the business case. Hopefully by October of this year, we will get DH approval, and that will see the stage 4 of the formal construction contract then signed off in November this year, and that will hopefully lead to handing the new building over by September 2023. Clearly, there will be some further refurbishment work. You know, we are not building an entirely new hospital site on West Cumberland. We are building quite a large new build, but we do intend to do some further refurbishment of some of the older estate, certainly by July 2024. And by April 26 should see the completion of some of the external works, some of the roads and the car parks arrangements that we need to do to complete the project. Clearly, regular updates on progress and any changes to the above milestones will be communicated with our partners, with our staff and the community as we go. Next slide, please. So as I said at the beginning, this is really some early attempts to really engage with our community in West Cumberland, to try to test out and look for some feedback on this exciting development. There are other opportunities, there are other channels as well available, you know, whether that's through the public website or whether it's via newsletters, and hopefully some more future MS Teams events like what we're having at the moment. And I would really encourage people to try to attend and to try to provide us with any feedback through these different channels wherever possible. I'd like to pause now and just hand over, if I may, to my colleague Mike Walker, who's going to talk a little bit about some of the principles of care and some of the clinical models that we're looking to develop at the site. Mike.
Thanks, Dean. For those that are not aware, I've been here for very many years and I've been involved in the development of phase 1, and I think it is probably important we revisit the context of where we are now. And as most of you out there in the public will be aware, phase 1 development was basically to re-provide both emergency and elective services for our local population. but it was also to try and evolve and develop an elective care centre, which was thought would be an appropriate way to drive elective care, not just for the West population, but also for Northumbria. The other aim was to try and make sure that we developed facilities that got the patient with the right person at the right time in the right place, with the aim of trying to improve the efficiency of care. So as we move to phase 2, the same principles exist about re-providing the services that we're unable to provide with the funding that was made available for us in phase 1. And that's exactly what's happened. And Dean's explained how some of these services are going to be re-provided. But perhaps more importantly than that, the delay in getting the phase 2 facilities developed has allowed us to take stock, because we've realised we need to be much more responsive to the needs of the NHS and public. And the past year with the COVID pandemic has shown us that we really need to be much more responsive and develop flexible facilities that will allow us to provide care and adapt to situations that arise. So, for example, to demonstrate that, one of the things that happened quickly after we opened phase 1 is we realised that we didn't have enough day case facilities, and so we extended the day case unit from 12 beds. That was important. That did two things. It provided better pathways of care for most of our patients who actually were day cases, but it also allowed us to have a flexibility with part of Ward 1. And that flexibility has been absolutely crucial with the COVID crisis, because what that's enabled us to do is to have COVID patients inside rooms in that area, which has made the whole system much more efficient and also much more safe for both patient and staff. Other elements of the flexibility are in that we've been able to think through what to do with en bloc. Now, en bloc's the area that was the old maternity area building. And what we've been able to do is thinking through developing a flexible and accommodation facilities. We've created space in the O'Reilly ward to escalate into if the bed base is insufficient. But we've not just said, okay, it's going to be beds to sit there. It's a multi-purpose area. And so the vaccination hub has been in there, and we'll be moving back there shortly. Similarly, on the Skidder ward, which is above the Ranundel area, we've refurbished that area to also accommodate extra and escalate beds into if that's required. But it won't be required most of the time, and so we're using that as an outpatient facility. So it just demonstrates that we need to be ever more responsive and adapt rapidly in situations we've got in the NHS. Now, the other thing that creates with the new facilities is it enables our staff to work in an excellent environment, and that is clearly key. And most will be aware is we've struggled at times to have a sustainable workforce here. But more than that, new facilities help us drive more efficient care. And so, for example, on the SDEC area, which is the new pod that Dean has described, it's same-day emergency care facility. That is hugely important to the provision of emergency care on site here. I'm a surgeon, and in the old days when I started here, what would happen? I would be referred a patient on an on-call day. That would be referred in by me. Be phoned into my the most junior doctor, who would put the patient in a bed. I would see them the next day, and then we'd start to investigate. And that patient could be in the ward for 4 or 5 days before we could make progress in the diagnosis and the management plan. And that was done purely by the surgical team. With the new SDEC facility, what will happen is the GPs or the emergency care doctors will speak with our team. The team I work with is no longer doctors, it's surgical care practitioners who are senior nurses who've evolved and developed surgical expertise. They will then see the patient and assess the patients in the SDEC area, and they'll be assessed, investigations undertaken, x-rays done, a diagnosis made, and decision in terms of whether they need to be moved into the assessment beds to stay overnight, or maybe into the short stay ward, which will be for 2 or 3 days. And the occasional patient will be required to be sent off to Carlisle. So not only do we have excellent facilities for this staff to work within, the actual space created helps us work for more efficient and effective care. And that's important because we need to drive the urgent care more effectively across both Allerdale and Copeland. And it's hoped that as we move forward, that the increased cooperative working that's taking place by both the doctors, the multi-skilled healthcare professionals, and indeed social service will provide for much better urgent care patient journeys for our patients. And the other thing it will do, it will help us increase the throughput of elective surgical cases on the West Cumberland site. And it's felt that we may have to reclaim some of our Ward 1 beds as we increase the surgical throughput through these beds. Thanks, Gav.
Lovely, thank you, Mike. Thanks for explaining that so well. So we do have some questions that have been submitted in advance, quite a few actually, from people who either are attending or couldn't attend and wanted to ask a question. But also, if you are on the event live and you do have a question that's popped into your head, do put it in the chat box on the right hand side and we'll try to get to as many of those as we can. We've got one in there now already. I'll come back to that. I'm going to go first of all to the some questions we've had submitted in advance, and it's really about details about the bed configuration. So I was going to ask Yvonne to comment on this. So in relation to the 60 beds that we've talked about through the communications, will this be 2 30-bedded units, or will palliative care be provided as a separate unit and not on the end of the rehab ward as it is now? And then subsequently to that, will they be back to the 4-bedded units and a few single wards? Yvonne, could you pick that one up, please?
Yes, so the new build will be comprised of 2 floors. The top floor, which is level 4 in the hospital, comprises a 32-bedded ward area. And on the ground floor, which is level 3, that provides a 28-bedded ward area, which holds the specialist palliative care beds. And as some of you may be aware, but we are commissioned as a trust to provide 4 specialist palliative care beds for the area. Those beds, if they are full and they are on the 28-bedded unit, if they are full and another patient requires that support, we will be able to flex into the single beds on that area as well. The workforce is an integrated workforce now, which enables us to do that for our patients. With regard to the wards, we have, they comprise of single ensuite rooms, bariatric ensuite rooms, and 3-bedded or 4-bedded bays with ensuite facilities. The bays have ample space, which is requirement, and they have doors on the area, and there are toilet facilities and shower facilities within the bays. They meet all the requirements nationally that we have to meet now. So the wards are they are better than their current old facility. What we did find in the old build, in the phase 1, when we did the new build there on wards 1 and 2, they are all single ensuite rooms, but in those ward areas there are no day rooms or ability, which sometimes patients do need to interact and see other patients. So that is why the design has been made as a combination of bays and single ensuite rooms. There you go.
Okay, lovely. Thank you, Yvonne. So we did have quite a lot of questions about the palliative care provision. So I think Yvonne's covered those within that answer, but we will, as I say, put a summary on our website. So there's a question specifically about the paediatric provision as well. So paediatrics can't be too close to the wards. Will this have its own entrance, and will there be a parents' accommodation or respite area?
So with regard to paediatrics, we cannot provide an external separate entrance to the short stay assessment unit, and the short stay assessment unit is on level 4, but it is separate, completely separate from the adult ward. Within the paediatric unit, there will be a family room for respite for the parents or carers to go to at any time that they choose.
Okay, thank you. So there's a part of this question, I'm going to come to you, Mike, on this one. What are the staffing arrangements for medical staff, such as consultants and doctors, on the elderly care and rehab?
Thanks, yeah. I mean, that's a really good question. We've struggled over the years to be able to recruit staff, and having spoken to the lead of the medical area, it's reassuring to know that we did have a full complement of consultant staff. However, over the weekend, one has given back word, so we are back out to advert for one consultant. Okay, but otherwise, we have a full complement of medical consultants to staff both the medical and elder care areas. Really important step. Importantly, it's really important to get across the message that it's more than about consultants. Say we're now working in big teams, and so the other issue, which is important to make all aware, is to have a full complement of trainees, both at junior level and senior level, and that's something we've struggled with as well. But at the present time, we have got a full complement, and interestingly enough, I've also heard over the past few days that the Newcastle Deanery is keen to send us some senior trainees back to the West Cumberland site. Now, they were taken away many years ago, and I think that's because they've recognised that we can provide good training for these individuals within our new facilities, and so that is a really good thing for us to be aware of. I've already alluded to the issues around the composite workforce, and I can't overemphasize the importance of this group of staff. The individuals most of them have come from nursing background or a science background, but they are specialists and experts in their own right. And so it's not just nurses now, we have nurse practitioners, advanced care practitioners, physicians associate, surgical care practitioners. There's a whole number of different experts that are used within the teams to supplement the care of doctors. And I think our composite workforce model is the envy of many across the country. And we'd really lead the way with that. And that's really important. And then to that end, we're actually increasing the numbers of these individuals in the elder care ward as well. So we're out to advert for both physicians associates and advanced care practitioners for the elderly care areas.
Okay, lovely, thank you. So Dean, I'm just going to come to you now with one of the other questions that we've got in, and this really is about service provision though. It's saying, are any services at West going to be lost during or after further redevelopment?
Thanks, Kath. That's a really good question. The short answer is no. No services will be lost. In fact, to the contrary, we're trying to develop facilities that will try and actually encourage the provision of extra facilities in certain areas, as Mike has already alluded to, around our elective care intentions. We do want to make it a bit of a centre of excellence for elective care. So quite the contrary. Plus, the other thing is, should we, even if we were to think about that, there'd be quite an awful lot of detailed public consultation that would have to be gone through. But as I say, at the minute, no intention whatsoever to change services.
Okay, thank you. And related to that, Dean, we're asking about the length of stay of children in the paediatric area. Do many children get moved to the Cumberland Infirmary? Is 7 sufficient? Again, that's coming back to what services we're commissioned to provide.
Again, sorry, Yvonne, did you want to?
Should I come into that one?
Yes, sorry, Yvonne, if you could respond to that.
Yeah, so we have within the short stay paediatric area, we have 7 inpatient beds and there are 7 assessment beds, and that was consulted on and was part of the consultation process, and we are not proposing to change anything there. What we will do is the environment will be much more enhanced going forward.
Okay, thank you. So I do have I've got a couple that have come in on the chat box. So I'm going to move to those and then I'm going to come back to the other ones that have been answered. So there's one from Richard Hardiman in the chat box that's saying, having been involved with the first phase, are the plans for the second phase following the same detail, for example, parking arrangements? I'm not sure who's best placed to answer that, Yvonne.
Yes, we are looking at that. We are going into the same detail as previously, very detailed. There is the governance structures, there's boards there, stakeholder group meetings, and the designs of each area is very detailed plans with the user groups. With regard to the car parking, we know that we have 932, if I can remember rightly, car parking spaces at West, which are 54 are disabled spaces. This will increase once we have finished the development, because we will be taking some of the old buildings down, which H block, which is no longer required, and having more parking spaces at the front of the main entrance, which will be beneficial for yourselves, the public. So it'd be good.
Thanks for that, Yvonne. So I'm going to also there's a question in from Viv Stuck, which says, can you please explain what you mean by integrated workforce and what palliative care training is involved? I think that was related to a point we made a bit earlier on, and I think, Mike, you subsequently explained a little bit about integrated workforce. Would you mind just explaining that again briefly, if that's possible?
Sure, Kath. Okay. Well, I think it's an interesting question, because in my view, in the West Cumbrian model, the end of life of palliative care service has been a truly integrated model from the very first days I've worked here. It has been an exemplar model in my view. Okay, and that's because there's an interface between the hospital beds or the palliative care beds and those in the community, but that's an artificial wall in the end of life care model with our staff, and patients flow freely as if the wall doesn't exist. Now, that's not the case with our other models of care, and that's the model we need to push towards. And one of the valuable things that's happened with the development of the urgent care hub is that we're trying to evolve that same connections or connectivity with the primary care teams to allow patients to flow freely, not just in the end of life sense within that palliative care service, but also as urgent patients into our SDEC area and our emergency department. Because the communication is key. My own views on this are that will hugely increase knowledge of both the staff who are home-based in the community or home-based in the hospital. We can learn from each other. We've learned from each other in the end-of-life teams. We will learn from our community partners if we get a chance to work with them. And from my perspective, that's a true integrated service. It's seamless, and people can work alongside each other and learn from each other. And I think I would aspire to that kind of the end-of-life model, or the way that integrated service works for many of our services, but particularly the emergency service.
Okay, thank you. So I'm just going to come on to a couple of the detailed questions that have been asked as well, relating to what's happening with the old doctors' houses on the estate below the hospital. Yvonne, could you respond to that one?
Yeah, so those houses that have been derelict for quite a number of years are finally going to be demolished, and the plan is to do that this year, 2021, and it will be in 2 phases as we can move through them. But yes, they will be coming down, which will be a real benefit.
Okay, great. Thank you for clarifying that, Yvonne. And we've got a question that's come in from Christine Warrior that I'm going to ask Mike to respond to. So how do you plan to staff these extra beds? Will How do you plan to staff these extra beds? Will there now Ward 4 be affected? Is the question.
Thanks, Kath. Yeah, the age-old problem is how we staff the bed base, however big or small that is. And I think that's one of the issues here. It's all very well to increase the bed base, but we need to have the staff to staff it. But I think there's more to just the numbers of beds. There's something about the flexibility and having the space. It's one of the things that we've had to do with COVID. We've had to divide the hospital bed areas into what we call them green, red, and amber, and that gives us much more space. And so I think it's hugely unlikely we'll have to at any stage staff all these escalation beds. But for example, we have got the Ward 7 refurbished, and we did have to move into that for a short period over the most difficult part of the recent wave. And it's difficult. It's difficult. We've had to alter the way staff have worked, and they've been redeployed, and that has also been difficult. So it's going to be difficult. If we had to staff all the spaces we have now, we couldn't do it tomorrow. We just couldn't. One of the things that has happened over the very recent past is that we've got a large number of Indian nurses who've already started to work on the Carlisle site that are going to be working on both sites. Now, these are, from what I understand, all very enthusiastic individuals, and that's one of the ways that we're going to be able to staff the shortfall in the nursing base as we move forward in short term. But having worked here for many years, I don't think we'll ever be at the point where we need to staff all these beds, but we will need to escalate and open some up and then close them down for different reasons, whether it's a COVID pandemic or whatever it might be. And we need to try and keep that workforce flexible, and we need to try and create a process that allow us to open and close these areas quickly in order to meet the demands placed on us by whatever is going on. But the increase in the numbers of nurses is a big step forward. We've never managed to put that number to our trust, and there's enough there to really make a difference.
Well, thanks, Mike. And the international nurses that you referred to there. So we do have our first cohort who arrived in the last couple of weeks, and we've got another cohort arriving on Monday. So we have secured up to over 100 international recruits by the end of this year. So that's in relation to that question. Dean, I just wondered if it was worth just clarifying there on the bed base that obviously the beds, this is about us. There's no change in the bed base essentially, but this will allow us more flexibility.
Sure. Again, just to echo your point, Kath, no change in the bed base. As Mike's alluded to already, hopefully through the design, through the new build, it will give us more flexibility, more options to reconfigure things and give us some flexibility in the future to be able to respond to pressures and needs as and when they happen. So yeah, but no change on the bed base.
And I think that leads into the next question that we've got, which is relating to what's happened on the Carlisle site when that was originally built, and the changes that have happened in the wards, the addition of temporary wards, etc. And they're asking, have we learned anything from that to prevent that happening at West Cumberland Hospital? And I hope that the answers around the flexibility in the bed base have demonstrated that we have. And I don't know, Mike, if you wanted to add anything further to that, and just to end on this point really about what you see for the future of services at West Cumberland Hospital.
I mean, I really do think we have learned, and I think speaking to colleagues who've worked on the Carlisle site for many years, I think with hindsight, the whole development of that should have been different right from the word go. And I think it has been really difficult to manage this crisis over the past year, and it's because enough space. And I think we know that, and we're in the fortunate position here on this site. We had some foresight because we were pushed very hard to take down all the buildings that we weren't using for phase one because they cost just to have there. But I'm so glad that people listened and said, we need to keep these buildings because we just don't know what's around the corner. And I think that puts us on this site in such a good position with the flexibility, not just the number of beds, but how we can move them around. And I think so. Yes, we've learned. As far as what's happened, well, Yvonne and I have been here a long time. I've been working on developing the phase 1 and now phase 2 for over 10 years. I do, for the first time, really see that we've got a plan that's nearly there. The added bit is the flexibility. I've never seen how we could cope with the changes that we're being faced to do. And it's not just changes, next year, it's within weeks. And so, we have learned, and we've got that capacity now on site with the flexibility of the facilities and accommodation. And I think that's really exciting, because I think we have got a sustainable model in terms of the accommodation. But we've already had questions about the staffing of that. That's also really key. We've struggled, as long as I've been here, to have a sustainable staff model. We have now. The composite workforce has changed that. And that is really important to recognise, because these are local people. They've trained here. Staff I work with, mostly, I've been here for as long as I have. Over 20 years they've been working it. Okay, so they care. It's their hospital, and that really matters when we've got this a system that has had difficulty for ever since I've been here. It's had difficulties. So the composite workforce is really important, and I think that's what makes the model sustainable. And because we've got the new facilities, people are voting with their feet. So it's very common for me in my outpatient ward now to have people who've chosen to come down to West, not just for an outpatient appointment. They want to come here for surgery as well, because they've heard what the facilities are like. So I think we're on the cusp of just about cracking, and not that I wasn't sure it would be cracked in the time I was here. But I think at last I can see future, not just with the phase 2 with the re-provision, but with the flexibility we're creating.
Lovely, thank you, Mike. And I think we'll end on that point. And I think a lot of hope there and optimism for the future. We've got a lot of investment secured, and we've got a great team planning that. So we're really keen to hear your feedback, and we've had quite a lot of questions in today, which is really great to see. We are wondering whether we should put on another event like this. So please do let us know if you think it's worked, it hasn't worked, what else you would like to do. Obviously, we'd love to have face-to-face meetings, but that's just not possible right at the moment. But maybe in the summer, if the PM says we can, then perhaps we could do that. So please keep sending your questions in. Please keep an eye on our communications channels, and get in touch with us on the communications team if you do have any issues or queries that you want to pick up. So thank you very much.